You just received your results for a tuberculosis skin test and it came back negative. What a relief, right? But have you ever wondered if there could be anything affecting that result, making it seem negative when it might not be the whole picture? A negative tuberculosis skin test, also known as a TST or Mantoux test, generally means that you have not been infected with the tuberculosis bacteria. This is fantastic news, indicating that your immune system has likely not encountered the specific components of the bacteria that the test is designed to detect. However, it is important to know that several factors can sometimes influence this result, potentially leading to a false negative. The reason these factors matter is because the TST relies on your body's immune response. When the test is administered, a small amount of a substance called tuberculin is injected just under your skin. If you have been infected with tuberculosis, your immune system will recognize this tuberculin and typically cause a raised from bump to appear at the injection site within 48 to 72 hours. If your immune system is compromised or otherwise unable to mount this specific reaction, the test might show a negative result even if you carry the bacteria. This is why understanding these influences is key. So, what can affect this immune response and lead to a negative result when infection might actually be present? One common reason is a very recent infection. Your body needs a few weeks to develop an immune response after exposure, known as the window period. Testing too soon can result in a false negative. Another significant factor is a weakened immune system. Conditions like HIV, certain cancers, or even medications such as corticosteroids can suppress your immune system, preventing it from reacting to the tuberculin. Very young children and some elderly individuals may also have a less robust immune response. Malnutrition can also play a role, as can an overwhelming active tuberculosis disease where the body's immune system is severely compromised and unable to react effectively. Finally, issues with the test itself, such as incorrect administration or reading, can also affect the outcome. To ensure you fully understand your situation, it is always best to have an open conversation with your healthcare provider. If you have known risk factors for tuberculosis exposure, or if you have a weakened immune system, your doctor may recommend further evaluation, regardless of a negative skin test. This could involve a repeat skin test after a suitable period or considering alternative testing methods to get a more comprehensive assessment of your health. An important insider detail here is that there are other tests available, known as interferon gamma releases assays or IGRAS. These are blood tests, such as quantiferon, TB Gold, and T-spot TB, which directly measure immune system markers. They are often more specific and less affected by previous BCG vaccination, which is a vaccine against tuberculosis. These tests can provide a clearer picture, especially in situations where the skin test might be ambiguous or influenced by other factors. Ultimately, a negative tuberculosis skin test is usually a very welcome result. But by being aware of the various factors that can influence it, you can have a more informed discussion with your healthcare team. This empowers you to seek additional clarity if needed and ensures that you receive the most accurate assessment of your tuberculosis status, giving you true peace of mind about your health.